Here we are. Here's the MTC, and join us on the Auburn Medical Group YouTube live show for our people who are already watching. Oh, here he comes now.
Who is it?
It's Dr. Gawain.
Of course it is.
Okay, so you're probably noticing that this is kind of a different setup from our usual, and that's because somebody forgot the key, sorry, to the studio. So we came up with an alternative, and it works. You guys are there.
And I just showed up. I just walked in.
I
was working. I'm glad the lighting works in here. Wow.
It's good.
Makes my
and we actually can even read the comments while we're looking at ourselves. It's like the old-fashioned way. So we need to say hi to just me and Bianca. And if anybody else happens to do the super chat, we'll certainly notice that. And we even have a chair right here.
I'm trying to remember where I'm looking. Is it over here?
It's right.
Okay. There we go. Got it.
So it's right where the finger is.
So I can actually.
So Bonnie Rodriguez and Laura Spritz and Rant and Dave 1982.
Apparently we need to get up like this to read it though.
I like that. It's really bright.
Yeah.
And
yeah, your head looks twice as big as
look, it's Ben. It's Ben. Ben Calderon.
Oh, hey. Hey, Ben.
Hey, Ben.
Well, I haven't seen him in
long time no see.
Probably over a year.
Okay. Well, Ben,
anyway.
Update us on how things are going here. And Summer Rosso, first time ever doing live chat. I hope I'm doing this right.
You are. We got your chat.
You got it completely wrong.
You got it all
You're
down.
supposed to first say dittos or something. I think that's the lab person. Anyway, the location for this is right in front of our front door of the office.
Over the back of your head.
It's interesting. Another Sullivan, hello. Oh, what's happening here? Is she going to join us? Wouldn't that be great?
No, she's locking.
She's locking the door. She's locking us.
Oh, so she doesn't want anybody coming in on the show.
She did it this way instead of walking around this way.
She didn't want to.
So
that's all right. People are like,
we just had Ashley walk outside to lock the front door.
Really disorganized.
Yeah, really disorganized.
Anyways.
Hey, what are we talking about today?
What are we talking about? Anxiety.
I was
really anxious.
So stressed about this show. Did you guys read about anxiety in the Dr. Green Knight blog?
Did you? It was last week's post. So
yeah, you know, I should really move this, shouldn't I? Let's see here.
Right.
Not quite the usual camera setup, is it?
Kind of a weird. Okay. There. Yeah. So anxiety. It was last week's post. So hopefully you check that out. This week's was on social media, which can sometimes bring anxiety to people as well. You do want to talk about social media because that is our main platform for getting out to you.
I can't trash talk ourselves.
It's a good one though. There's some research on social media and. We're back to anxiety.
I'm nervous about talking to all these people at once. And
somebody takes medicine for anxiety.
We're going to be talking about that.
Yeah, we'll be talking about those medicines. Yeah. So I guess first we should talk about the different types of anxiety.
Okay. What kind of anxieties?
Let's see. Generalized anxiety disorder.
That's kind of the broad one. Oh, look, we have somebody who's coming to a locked door. This is great.
You locked him out.
He's just leaving. He tried the door and he's... Oh, don't go away, man. Just leave. Wait, how's it go? I'm sorry. Oh, he's coming back. He's coming back.
Mad. Just leave.
Is he going to go to the other door? Oh, he's talking to Polly. Okay. I'm sorry. Generalized anxiety disorder.
Generalized anxiety disorder.
Like you don't know when somebody's going to open your door at any moment. Right?
You get anxious about doors.
Right where you're doing the show.
Yeah. And that's just kind of a... So, well, first of all, anxiety is kind of this feeling of excessive worry or uneasiness. You kind of feel... I guess that's a good way to describe it. How else would you describe it?
Well, people who experience it would probably say that's a terrible understatement.
Yeah, oh, absolutely. But it's like that to the nth degree.
Yeah.
So generalized anxiety is when you have that every day, essentially.
Probably
it's just generalized.
Varying degrees.
Yeah, but it's pretty pervasive.
If I were to talk about generalized anxiety disorder, I would say, think of Ben Calderon. And that's not it.
No. Yeah.
No one knows. That's an example of what it's not.
So that's generalized anxiety disorder. Other times, I can't talk. Other times it can be brought on by things. So there can be phobias, anxiety due to specific triggers, situations.
There you go.
Triggers.
Yeah. He knows that word.
Like social anxiety.
It's a trigger word.
Stage fright, like my dear friend here has.
Oh, the chest pain came back.
Oh, yeah. Where's my propranolol?
What is that?
Hopefully talking about that.
Let's talk about costochondritis right now.
Costochondritis. Does it hurt when you push on your chest?
Yes, it does.
And And then panic attacks. So panic attacks can sometimes be brought on by certain situations, but sometimes they just come out of nowhere. But they are very, very intense, very specific, short-lived usually, severe panic or severe anxiety.
Noises.
Yeah, and you usually experience physical symptoms along with that. Heart pounding, sweating, chest pain often can be mistaken, or at least the person can mistake it for.
Mine's costochondritis.
for
Not anxiety.
Or anxiety. Yeah, well, or heart attack. You know, people can sometimes be concerned, and then obviously that brings on more anxiety, and you can end up in the ER.
Builds on itself.
With that sort of thing. So, so those are some different types of anxiety. Did I miss anything? Anything else?
You said social, which would be agoraphobia, which is something that people may have heard or read about or experienced.
Going out in a lot of
people. The hand tingling, yes, hand tingling.
Yes.
Let's talk about how that happens.
Lip tingling.
What's the mechanism?
So you can start. People are like waving at us in the other room. So you get so it's a chair. Carbon dioxide actually. So when you are breathing, you breathe in oxygen, you breathe out carbon dioxide. And if you start to have a panic attack, you can hyperventilate. And when you hyperventilate, you are breathing out too much carbon dioxide.
It's the carbon dioxide.
And that is an acid in your system, and that you can get some abnormalities that then make your hands tingle and your lips tingle. Those are the common locations.
Changes the actual pH of your blood.
Yeah.
So those people are all excited about their pH. They can change it just by breathing differently.
Whoever that was said they were a recluse because of it. Probably a.
Okay, so and that would be a reason for medication when it's affecting your social well-being.
At age 20, now at age 65. Oh man, that's all 45 years of that. That can be devastating. I'm sorry you have that. Somebody else has panic attacks.
Maybe we should talk about how we can help that.
Yeah. So treatment. So there's essentially two main categories of treatment. One would be medication, or another one would be counseling.
I guess backing up a step would be to say that we would rule out the symptoms aren't from some kind
diagnosing.
of
Yeah. So first is diagnosis. So sometimes you do need to do some blood work to make sure you don't have a thyroid disorder or some underlying cause. Thyroid's the one that always comes up.
Pheochromocytoma.
Yeah, something. Because it could happen. Though.
It could.
But yeah, there are things that can cause it. So yes, sometimes we do need to do some basic blood work, basic physical exam, make sure that you don't have some underlying physical condition causing the anxiety.
Find their heart rate's like 140.
Right, yeah. High blood pressure can make you feel anxious even. So if you get that treated, or heart disease, sometimes some lung disorder, it's actually a lot of different things that can cause anxiety. But what we're talking about is a true psychological disorder where everything physically is normal, or maybe not normal, but not causing.
So I'm sorry, I interrupted you when you're talking about.
So then treatment. So the treatment comes down
conservative measures.
Yeah. So often you can do basic things at home. Let's talk about that first. Maybe things you can do to try to help out with it. So.
Well, this guy's staying at home. He's already doing it.
Well, yeah.
There you go. Problem solved.
That keeps you away from it, but that's not really any way to live if you need to have a social life, or if you need to, or if it's causing you distress. So one is the basics: eating healthy, getting exercise, sleeping well, getting a good night's sleep, nice restorative sleep.
Spending time outdoors.
And then limiting all those stimulants. So caffeine is a big one. Some people are really sensitive to caffeine. And
aggravates.
And if they're having their cup of coffee every morning, or their Starbucks cup, that can be enough to cause their daily anxiety. So sometimes you need to stop that. Go to the decaf, or go nothing at all. And not just that, but the drinks, what are they called? Energy drinks. Oh my goodness, they have a lot of caffeine, so that can be more than you need.
I drove long drive, 6 hours down, 6 hours back.
And you had a Monster. Did you feel anxious on your drive?
No, not at all.
You just were able to stay up.
Actually, I was surprisingly calm and comfortable with all the driving. Monster. Ultra red and ultra blue. I tried one drive on back, and I stayed awake the whole time. So
because you wanted to pee the whole time. That's what I find. That caffeine just.
No, I go ahead and stop.
Energy drinks.
That is
it just runs through
and I do what I need to, and then I get back in the car and go.
Oh, okay. Well, that's good. That's what it's supposed to do. That would be about the only time I would say to use it.
It is good to make stops when you're driving. It is good to.
It is, yeah. You don't want to fall asleep. What other things you can do at home? Deep breathing. So if you are having a panic attack, you want to do some deep breathing. You know, in the bag, breathing into a bag actually does have a place because you're hyperventilating, you're breathing out too much CO2, carbon dioxide, and you're losing it. So when you put the bag over your face, that actually is helping recirculate, helping you get some of that carbon dioxide back in, and that can slow down your breathing. It can then stop anxiety attack.
And as they breathe out, that's still a lot of oxygen because your blood or
so
your lungs are 100% taking the oxygen out. So it's actually some oxygen in that rebreathed air.
Yeah, so you're not getting...
So it's not like you're killing yourself,
yeah.
but it could.
I guess if you did it enough, you probably would. If you never stopped and just breathed into a bag.
When you pass out, drop the bag and start breathing regular air.
You're probably right. You're probably right.
Don't try it. Please don't prove us wrong.
Please don't video it. Send that in.
We absolutely do not want this video shown on a 10-foot screen in a courtroom.
No, that'd be bad. Look what these doctors told me to do.
They said it'd be fine.
Yeah, I'd be fine. They said I'd pass out before I died.
We hope.
Hey, Taiwan.
Taiwan, that's awesome.
Yeah. So those are some basic things. If you're doing all that and you're really not getting the relief you need, then you should seek professional help.
Now, some people will medicate with alcohol.
Yes. And that
because it'll calm the shakes.
Yeah, but it actually makes it worse. So as you go through the withdrawal of alcohol or coming off alcohol, that can increase your anxiety. And even though alcohol works on the same receptors in the brain as some anxiety medications, that's not a good way to treat it, though, because of the addictiveness and.
Well, yeah, go ahead. Sorry.
I
was just going to say that's why I don't use those medicines even.
Yeah, and we'll get to that. Some of those, they're called benzodiazepines that work on the GABA receptors in the brain. They are very addictive and should really only be used for short periods of time and intermittently or very, very rarely. So,
I'm writing the prescription for this number of pills. There's not a refill to this.
Yeah,
it's
right,
to
exactly.
Get us to a certain goal, place. Yeah.
So maybe we should talk about those medications and move into the medications that can help out with anxiety. So often people have generalized anxiety disorder or anxiety on most days, and that's when we want to try a daily medication to help out with them. And actually the best medication for that is antidepressants, those SSRIs, selective serotonin reuptake inhibitors.
Like
Prozac.
There you go.
Good old Prozac. And the newer ones, Lexapro, Celexa, those work really well as well.
Yeah.
Those are actually, Lexapro is kind of my go-to these days. That's what I use often. But Prozac works great. Yeah. It's really good for anxiety.
Cheap, inexpensive.
Yeah, tried and true.
The side effects, although they
does have some side effects you need to look out for.
They're not like, for the most part, not dangerous. I mean, it can be, all of them can have dangerous side effects.
Sure.
If used in certain settings. But for the most part, if there are other medicines around to interact with.
Right. Yeah.
Actually, pretty safe medicine.
Pretty safe. Prozac should probably be in the water.
No, probably in the water.
Just kidding.
It's in the water.
Yeah.
Vitamin P.
Vitamin P.
That didn't sound good.
No, that didn't. Yeah.
Should we call it fluoxetine, vitamin F?
Vitamin F. That's not much better.
That's like fluoride.
I like Lexapro.
Oh.
Lexapro is great.
Okay.
So those are the usual daily medications we use. There's one other one which the mechanism is not fully understood called Buspar that we use. But the problem is you need to take it 3 times a day often. So it's not. I have
had people use that PRN.
As needed, yeah.
It worked.
It does.
And it's not addictive.
Yeah, it's not addictive, which is nice. But yeah, if you need to take it daily and you're taking it 3 times a day, that's hard for anybody to take something like that. So I stick with the SSRIs. So that's the daily medications. The as-needed medications are another class of medications, usually used for something that's intermittent, like panic disorder, the phobias, public speaking, some people that need to go in front of big audiences.
And you can use different medicines. You can use the benzodiazepines, like the alprazolam for the anxiety.
Yeah, so I'm sure you've heard of some of these, Xanax, Ativan,
which we
clonazepam.
really don't. Not a lot of that comes out of this office.
Try to avoid those.
Yeah.
Because of their addictive power. And
although every once in a while you'll have the patient that says, yeah, certain things come up and it's awful nice to be able to not live in that state.
Sure.
And they'll show you their bottle from 3 years ago.
Yeah, where you gave them 10.
That still has some in it.
Yep.
I'd like this to be updated.
Yep. Yeah. And that's how it's supposed to be used.
Yeah.
And that's how it should be used.
Yeah. Not daily.
No, not daily. It's not good as a daily medication.
No.
Beyond that, there is another medication called propranolol, which actually works really well for public speaking and
I've actually done
social anxiety. Personal?
For his story.
Oh, yeah, really?
Yeah, I did.
Oh,
seriously.
Nice. I was in that.
So
it was a musical that our church put on.
I was an actor.
And I was.
And it got rid of the palpitations before going
Sure.
out in front of everybody, and
Yeah.
it will say my lines without feeling the quivering in the voice,
Yep.
which then makes you more anxious.
The knees knocking.
In front
all
of
that.
hundreds of people. So yeah, it worked. Well, here's the interesting thing: I only had to do it, have that experience of going out performing without having the heart racing and the voice getting shaky.
What are you talking about?
And the next time didn't need it anymore. It was pretty cool. So I've used it since. When was this story? Like 2001?
I don't know how you bring up old ones. Try and see what.
Oh, you can bring up old ones by going like.
Oh, there you go.
Like, there you go.
Yeah, that was 2001. That's a
So
long time ago. There's something about
just
weed.
me, Dr. Gilmore, just
Months later.
at just me, Dr. Gilmore.
Oh,
had
anxiety
somebody who
brought
took-
on by marijuana.
Oh, it can. You can have the
yeah.
acute reactive
You
response.
can do
to
that.
it.
You can get
Some people use it to
psychotic
treat-
even.
Yeah, you can have cyclic vomiting.
Cyclic vomiting. There
So-
are some things to think about if you're going to do
There's some people who have a
marijuana.
bad experience with that drug.
Yeah.
Yeah.
Yeah, and sometimes that's because it's laced with something else.
Yeah.
Because we've had those. We've had
we've
people
actually
come in
seen
like,
that
oh, I took
in
this
our
weed,
office.
and now I'm,
Yeah.
yeah. And then you find that it had
Little old
PCP
lady
in it.
gets her CBD or whatever, you find out it has ecstasy in it.
Yeah, I think that was the case. It was ecstasy. Oh, my
Yeah,
goodness.
not
Yeah.
just our office, but another office that we
Yeah,
talked to the
just
doctor.
me says marijuana helps her. So yeah, some people use it for
Yeah,
that.
some
And
people
truly,
find it helpful for anxiety.
it's safer than the benzodiazepines.
I'm pretty comfortable
go ahead
saying
and say that.
A lot of people, the anti-marijuana people say, oh, it's not been tested enough. You know what? We've been seeing this drug a lot over the last 3 decades in this country.
Yeah.
We pretty much know what the bad stuff is that it does. And
Yeah.
I'd rather have people use it than
Right.
benzodiazepines.
You can't. It's not going to kill you. Well, unless
rather
you
not have them smoke it.
drive under the influence and then get in a wreck or something like that. But just taking
Right,
it is
right.
not going to kill you. You cannot overdose.
It by itself
marijuana.
isn't killing somebody,
Yeah.
but in combination with bad judgment, like thinking,
or some
like
other
thinking they can fly.
medication. That's That's true. Yeah.
Yeah.
But just in itself, it's not going to
Yeah.
kill you.
Okay. I'm sorry, are you done?
I think so.
You did a good job.
Did I miss anything
That
else
was
on
really
anxiety?
thorough.
Oh, excellent. Maybe, and that was
I'd like
read the article. That
I'd
it's
like to
even more in
compliment
depth.
you. Yes, there's a link to, well, it's not to the specific article, but the link in the description is to drgreenknight.com.
Yeah, it's on the front page. Just scroll down. It'll be there.
Did you happen to listen to the last podcast from Changing Faith?
Oh man, that was good. Dr. Ord.
Dr. Ord,
Yeah, I really enjoyed that.
Northwest Nazarene University, Dr. Ord. Yeah.
Yeah. I haven't read the book, so some of the things I didn't fully get, but yeah, very good.
We did not really go into the book on it.
Yeah.
No, we were talking more around it.
Yeah.
Yeah. Otherwise, people wouldn't have to buy the book.
Right.
So what good is it to go
So
on
you
our
got-
podcast?
I got to go get it.
So what we're talking about is a podcast Leanne and I have called Changing Faith. Not to be confused with the Changing Faith podcast. They're both on iTunes.
Oh.
Ours is called Changing Faith. It has a picture of Leanne and me on the front. So if you listen to that on iTunes or wherever you get podcasts, please give us a 5-star rating. And if you listen to it and go, well, I'll rate it, but not 5 stars, we would really like for you to
Just call and complain to him.
rethink your life choices and come back to it later when you're ready to give it 5-star. But we would like 5-star reviews. There, that is my shameless promotion
There you go.
at the end of,
It was good.
because I can. And look, you guys aren't even talking, so I can totally say whatever I want.
It was good though. Yeah, for anybody of faith who has gone through some difficult times or had to experience some things and questioned, why did this happen to me? It's really good.
Oh, thank you.
And it
Appreciate that, Glenn.
It can hopefully answer some of the questions. Hopefully, I haven't read the book, but it's one that I need to get and need to read to get a different perspective on.
I know someone who has a copy you can borrow,
Oh, I think I'll have to take you up on that.
but it has a lot of sticky notes.
Oh, does it? That's all right.
over it.
Yeah.
Oh, by the way, how's our audio? Somebody write in and say, either you can hear
They've
us
been-
or can't. I
they've
hope
been
they can.
responding to
They've been
what we
responding
say,
as if they
so
do.
I
Nobody's
think so.
complaining about the sound.
We are not in the studio. As
We
you
are
can
not
see.
in the studio.
So we
We're
do
not
have-
using the professional equipment. We're just
Thumbs up.
using the mobile phone this time. And okay.
Audio is low, but fine.
Oh, okay.
And somebody else has great audio.
All
Okay.
right, so-
good enough.
Yeah, sorry about that. Hopefully you had a good time of learning about anxiety with Dr. Gawain.
Yeah.
And people can find you.
drgreenknight.com.
That's cool.
So go check it out. There's a link in the description below. Plenty of other articles and posts. This week's is on social media. So
social media.
If you use social media a lot, it'd probably be good to know how it's affecting your brain. So check it out.
Anybody you need?
Of course, always. BooBoo Kitty, you know who you are.
And Lindsay Vaughan.
You make it happen.
Will it blend? Will it burrito?
Yeah.
Coming next week. So
wait, what was that one? Somebody asking a question.
Oh, what are they asking?
The name of the podcast again.
Oh, Changing Faith.
Yeah, I thought somebody was asking you something.
Yes, I thought they're asking something else. Okay, and sorry we didn't get to all the comments. There are just so many that the only ones we can really guarantee we get to are the super chat.
Right.
No, I'm joking, but we would.
Yeah, we try to get to them.
So until next time, I need to thank Lindsay Vaughan. Thank you, Lindsay.
Did you already do that?
That's double thanks.
Double thanks.
Thank you. Thank you 2 times.
And thank you, Ben.
I was going to say that. And Ben Calderon. Thank you for letting us abuse you verbally on this podcast. And Ben, you might. Never mind. Ouch! It hurts when I laugh.
Stop.
Okay. Well, until next time.
Dr. Wayne Vaughan.
And Dr. Vaughan telling you to stay in good health. How do you stop this thing?
I don't know. Figure it out. I'll just keep talking.
We'll keep talking until we figure out.
Stop it.
How do you turn this thing off? What, the X?
Hey, there's an X.
I'll try the X. Okay, bye.